All right, now, Roy, do you hear me? I hear some feed through the system. Hello, Roy. Hello, Roy.
I got you, bro.
Good. All right.
Hold that mic there.
I do everything for you, Roy?
Well, I was going to say just leave it there, but can you grab it? Okay. Good. You look like Smurf.
I feel like Smurf.
Y'all ready? You didn't get your rocket engines going, huh?
No, really, no.
Push that go button.
No, I did. It's the wrong button. Hold on. There we go.
How long have you been doing this? Not today.
I want to thank y'all for coming out this afternoon. What our goal is here today is kind of twofold. First off, we're going to announce a public education campaign which really deals with not only the seasonal flu, but also H1N1. And then the other thing that we want to do is we want to kind of give you an update on what has changed with H1N1 since last spring. We're going to begin with Lou Brewer, who is our Director of Public Health, and she's going to give us some details on how to fight the flu, which is our campaign, again, Fight the Flu. And then we're going to follow that up with Dr. Parker, who is going to talk with us a little bit about how to identify symptoms, and then also once, if you feel like you've become sick, if you've got the flu, then maybe what to do from that standpoint. We're going to try to go through all of this and then have our questions at the end. So at this point in time, I'm going to turn it over to Lou Brewer.
Thank you,
Lou.
Judge, very much. Good afternoon. It's a pleasure to be here with you today. This is an opportunity that we have to speak to our residents of Tarrant County, because you are, after all, the first line of defense in preventing the spread of both seasonal and H1 flu. We have a public education campaign, as the judge alluded to, that we want to talk to you about. It's not complicated, and many of you are already practicing the 6 basic steps of prevention. These steps are: get vaccinated. And remember, there are 2 types of vaccine this year. One is for seasonal flu, and one is for H1N1 flu. Wash your hands often. Cover your cough or sneeze either with your sleeve or with a tissue. Avoid touching your eyes, your nose, your mouth. Avoid close contact with other people, particularly if either they are ill or have symptoms or you yourself. And of course, if you're sick or your child is sick, please stay at home or keep them home from school. 6 basic steps. We will be getting this message out on posters, flyers, door hangers, all of which are available at our website at health.tarrantcounty.com, which is up here on the screen. We are asking all of our community partners, such as school-based clinics, businesses, and individuals, faith-based organizations, to help us with this campaign, to download these materials if you haven't already done so, or use your own, and put the word out. Make sure that every building we walk into has the same message about the 6 prevention steps. Now, H1N1 and seasonal flu are mild to moderate illnesses. This is what we're seeing with the H1N1 so far. We all know that it's around the world, it's globally active, it's in our community. Because of this knowledge that it's mild to moderate, H1N1, and it's in the community, the World Health Organization, the Centers for Disease Control, the State Department of Health Services, and our own Tarrant County Public Health have stopped counting the specific number of cases of H1N1. We're not trying to test every person that has symptoms or count every case, because we know there are way more cases than we have counted to date. And we know it's in the community and it's mild to moderate. Therefore, we are now concentrating on the vaccination program for both seasonal flu and H1N1, our prevention messages such as we're doing today, and on continued flu surveillance. Now, here are some of the things that we're doing to ensure that our community stays healthy. We have added additional lab personnel to help us with that flu surveillance and testing should we need to go back to doing that again. We're providing more web-based information, and I already pointed to the website for you. When you go to our website, there's a button on the right that says H1N1 information, and you just click on that. We have cross-trained more of our staff who are not normally involved in this type of effort so that they can increase our ability to respond. And we have formalized our local medical advisory committee that we have been meeting with over time, and this includes infection disease doctors in the private sector, hospital physicians, representation from our local university, Health Sciences Center, and our Tarrant County Medical Society. Our plans for the fall include timely media messages. This is one of those. Communicating on a regular basis with our community stakeholders and our critical community partners, such as schools, healthcare facilities, private providers, school nurses, infection control nurses, business and industry, universities. At this time, school closures are not anticipated for H1N1, but we do urge schools who have not already done so to familiarize themselves with the CDC recommendations that were released on August 7th, and you can find those on the CDC website. Now, again, we're stressing the importance of getting your vaccination for seasonal flu and then H1N1. We are pleased to announce that our first seasonal flu event for vaccine will be next Tuesday, September 1st, from 9 a.m. to 2 p.m. at the Southwest Christian Church on Trail Lake Drive in Southwest Fort Worth. There will be more information about that event and others as they are posted on our website. We will continue to post events for seasonal flu vaccine on our website, and when we receive the H1N1 vaccine, the earliest I've heard is mid-October, could be later than that, then we will start to post those events as well. I thank you for your time, and I'll now turn it over to Judge Whitley.
Thank you, Lou. Again, what we want to stress there is that the vaccines are really going to be twofold. There's going to be the seasonal vaccine, which will occur next week for adults, and then later, probably in late October, we'll be looking at the H1N1 vaccine that will be coming. Again, we also want to stress the website that the public can go to, where they can health.tarrantcounty.com. Again, we've got it listed up there on the screen. And again, that's where we want the businesses, we want schools, we want families, individuals to go to be able to get a current update on the information there. At this time now, I'm going to call on our Tarrant County Health Authority, Dr. Sandra Parker, and she's going to talk about identifying the flu symptoms, and then also how do you protect your family and yourself from possibly getting that flu. Dr. Parker.
Thank you, Judge Whitley, and good afternoon to everyone. I would like to take a moment to stress the importance of correctly identifying the H1N1 virus by its correct name, which is H1N1, and not using the common terminology of swine flu. This virus is a human influenza virus that contains additional genetic material from swine and avian influenza viruses, but it is a human virus. This virus has not been identified in the swine population. Now that we have that out of the way, I would like to talk some specifics about how someone can recognize symptoms of possible illness due to either seasonal or H1 influenza. Some of these symptoms are quite similar in both diseases. Some of these things are cough, headache, body aches, and fever. In Texas, this fever has been reported to be greater than 102, which is a little bit more than what we typically see with seasonal influenza. Also in Texas, it was reported that more people had symptoms of diarrhea and vomiting than we typically see with the seasonal influenza. Now, what should someone do if they have these symptoms? Number one, stay at home. If you're sick or you feel sick, stay at home and avoid going out into other places other than going to visit your health care provider. Also be in contact with your health care provider. If you are ill, Call them and see if they can fit you into that, into their office early in the morning or late in the afternoon when no one else is there. Especially if you are in one of the high-risk groups for developing complications from influenza. Some of those people are pregnant women, people who have chronic lung or heart disease, diabetes, or a depressed immune system for one reason or another. While at your healthcare provider's office, they may decide that you need an antiviral medication. Antiviral medications fight the flu by trying to prevent the virus from reproducing in the body. It also helps the person feel better quicker, and it may lessen their risk of developing severe complications. One of the things that I wanted to stress to you about preventing the flu this season is vaccination, which Ms. Brewer has already mentioned. Not only seasonal vaccination, which should, as you know, she just said our first event is next Tuesday, but also the H1N1 vaccination. H1N1 vaccine, as has been mentioned, will likely be available in October, possibly as early as mid-October, but we are still receiving information on that. People who should receive the H1N1 vaccine first and then others to follow. The target groups for the H1N1 vaccine are pregnant females, household contacts of an infant less than 6 months of age, a healthcare worker or emergency medical service personnel, children and young adults aged 6 months to 24 years, and adults under the age of 65 with chronic medical conditions. Those are the ones who should receive the H1N1 vaccine first, to be followed by everyone else in the general community. One other thing that I wanted to mention is that despite all of our best efforts, despite following the 6 ways to fight the flu, which include both the seasonal and the H1N1 vaccine, we might get sick. We need to plan for that. We should have tissues at home. We should have medications to reduce fever at home, other over-the-counter medicines, and hand sanitizers. We should also plan for our child becoming sick, perhaps making alternate arrangements for child care should we need that, and also making arrangements for ourselves.
Thank you, Dr. Parker. One of the things, again, that our purpose for being here is to help people understand what's best and the best ways to fight the flu, not only the seasonal flu, but again, the H1N1 flu. You need to get the vaccines, both the seasonal as well as the H1N1, and you need to be able to recognize those symptoms, and if you have them, stay at home. Talk with your employer, let them know that you feel like you've got the flu. We're going to try to send out information which will indicate to the employers that this flu, you're probably looking at a 3 to 5 day length of period of time. Stay at home. Don't go back too soon. We really don't want to spread this among our workers. At this time, we're going to open it up for questions, and we'll see if we can answer any questions that you may have.
Question for Dr. Parker. Does the seasonal flu vaccine offer any protection whatsoever against H1N1?
Let me pause just 1 second and say, because we're live streaming this video, so we'll have it. Not only is it live out there right now, but we'll also have a copy of it on our website. So as we have done before, we're going to repeat your question as you ask it. Mr. Manius over here will repeat the question, and then we'll give Dr. Parker or Lou a chance to answer that.
So the question is, does the seasonal vaccine, does it have any impact on the H1N1 virus?
No, the seasonal influenza vaccine will not protect against the H1N1 virus at all.
Are immunizations the answer, the cure?
It's one of...
The question, we run into this every season that we do. The question is are the vaccines the answer, or are they the cure?
No, the vaccines are one of the answers. The prevention steps that were mentioned first are a good way to fight against the flu. The vaccine does not treat the illness because you're preventing the illness. The only things that treat the illness would be the antiviral medications that I spoke about.
Question on the, with this campaign and the intense nature of the education here, are we going to see a run on the regular seasonal vaccine flu like we did 2 years ago?
The question is, with the intensive campaign information that's being distributed, are we going to see a run on the seasonal flu vaccine?
Possibly, but it's hard for me to predict that.
Yes, ma'am.
In a very short period of time at TCU, we've seen the cases go from just a few to almost 100. At what point do we start to get worried?
The question was, there's been a rapid increase in the number of cases at TCU. At what point do we become concerned about what's happening at TCU?
Well, there has been a number of influenza-like illnesses at TCU. There isn't a specific number where we would become concerned. We're concerned with any cluster of illnesses in a specific population.
Yes.
Is there a certain percentage of kids before you shut down a school? Not necessarily just like TCU, but like an elementary. You have to reach a certain amount of kids to be sick before you say, we're going to shut the school down.
The question is there a certain number, or there a number that has to be present, the flu-like symptoms in children attending regular school that would trigger a closing of that school?
Well, we don't anticipate any school closures this fall, and there is no specific number that would dictate that a school, whether it be an elementary school or high school or university, be closed. You have to look at all of the information and talk with all of the stakeholders involved to determine what would possibly be the best decision for that individual facility.
You spelled out the campaign here, and this material is all available online, but what is the public health department and the county doing beyond that? Are you going to physically distribute this material, or what exactly?
The question is, we've developed the material, the county and the public health department has developed the material. How do we intend to do distribution on this, and what is our strategy moving forward?
We are working with our community stakeholders in the distribution of these materials.
Lou, do you have anything else that you would want to talk about as far as the distribution?
I think that is the main answer. We've been meeting with various stakeholders throughout the summer. We've been going over the message that we're giving you today, and we are making available all of our materials, plus keeping them informed on what's coming out as guidance from the Centers for Disease Control. A number of organizations have developed some of their own material and already have it out there. But we will continue to, we're meeting with another group this week, and we'll be talking about ways that they can take the information and then get it out in their neighborhoods and their communities, and we'll continue to do that as well. We also have everything in Spanish on our website, and we have Mr. Navarrete here today who will be doing this message again in Spanish as well.
And Lou, you might want to comment on our distribution of the material in public buildings.
Yes, we have posters, and the county has already put out hand washing dispensers in all of the county facilities, and we're going to have the prevention message out in all of our county facilities, and we hope that other businesses will do the same.
Yes.
Has Tarrant County recorded any N1H1 cases yet? If so, how many?
The question is, has Tarrant County recorded any H1N1 cases, and if so, how many?
Now, are you specifically talking about from the spring? Because we no longer count individual cases in the community.
Any new cases?
Well, we expect that there are new cases in the community, but we do not have a specific number on those cases because, again, we are not counting individual cases.
How will you record them?
Well, similar to seasonal influenza, H1N1 is not a reportable condition. So as such, we don't make individual counts of those cases. Now, we already know it's present in the community, and so because the symptoms of H1N1 and seasonal influenza are similar, and because currently the prevalence of the virus, of the H1N1 viruses is more than that of the seasonal influenza, you can assume that influenza-like symptoms may be due to H1N1. Now, regardless, the treatment is the same as we just discussed.
Are you worried?
Question is, are you worried?
No, I'm not worried. I think we are prepared. I know that there have been some recent information about worst-case planning scenarios. I think we're prepared, and we need to stay aware of the situation, but I'm not worried.
It seems like the groups that were studying this are being a little more, are backing off a little about school closings from months ago when all this happened. Is that because you have more information, or what? What's different now?
The question is that, I can repeat that question. The question is because of the information that we have now, it appears that some groups are backing away from school closings. Is that something you concur with?
We do have more information now. We have 6 months' knowledge on this virus as opposed to the spring.
And that's made a difference, I guess?
Yes, it has made a difference.
Dr. Parker, we've had, since school started, there's been a lot of reporting, or a lot of cases, the schools are saying they have a lot of cases. Do you know how quickly, once somebody's exposed, how quickly they become ill? And why it seems like they're all hopping at once right now? There's a lot of cases.
The question is, we're hearing some cases, or some instances where there are a lot of cases in the schools being reported, and the question is then becomes how long does it take for an individual to have those symptoms, and what should they do about it?
Well, from the time of exposure until the time a person becomes ill, we commonly refer to that as the incubation period. The incubation period is approximately 3 to 5 days. The reason that it seems to be popping up right now is that the children just went back to school this week. So whenever there is a situation where there's a large number of people who can gather, then viruses are spread more easily if you don't follow the practices of hand hygiene and coughing and covering your cough or your sneeze.
Got reports of pretty dramatic spike in the numbers at TCU, and also I've heard of a similar outbreak at Trinity High School. Are you all in contact with the officials of the schools? Do you have any comment, or are you working with them?
Question is, there's been a large number of cases reported at TCU and possibly at Trinity High School. Then the question becomes, have we been in contact with those two institutions?
We are working with TCU. I have not personally been in contact with Trinity High School.
What are you working specifically? What are you doing with TCU?
We've been in close communication with TCU since they started noticing this illness, just discussing and monitoring the situation.
We like the name swine. Sorry, we can't use it anymore. What is H1N1 actually? Is that a Latin phrase or something? What is that exactly?
Dr. Parker, would you explain what H1N1 is?
Yes. H1N1 refers to different surface proteins of the virus. The H stands for hemagglutinin, which is actually a compound that helps the virus get into the cells, and the neuraminidase is a compound that helps the newly formed viral particles escape and infect other cells. So the H and the N refer to different viral components.
Yeah. You see why we like swine flu.
I see why you do, but my favorite is H1N1. It's more descriptive.
Yes, it is.
Is there going to be a charge for any of these vaccinations, like seasonal flu and the N1H1 or H1N1 swine flu?
The question is, will there be a charge for the vaccinations for either the seasonal flu or the H1N1?
Most facilities do charge for the seasonal influenza vaccine, and although the vaccine, the H1N1 vaccine itself, is free of charge and being provided by the federal government, facilities can charge an administrative fee to give the vaccine.
What will this facility charge?
Tarrant County will charge 15 or 20, typical to what we charge for our seasonal influenza. I had to ask to be sure. Sorry about that. But I can't tell you what other facilities may charge.
There's been one death reported in Dallas today. Does that change anything about how you are going to deal with this?
The question is, there's been a death reported in Dallas County on the H1N1 virus. Does that change how we're going to approach this issue?
That is an unfortunate event, but it will not change how we are approaching this issue at this point.
Again, I want to thank everyone for coming today. Again, our purpose is to watch the websites. We're going to post information there, but again, we want to thank y'all for coming out today, and with that, we'll close the press conference.
Thank you, Jay.
Thank you.